Hello, my name is Nicole and I have decided to focus my presentation on malaria. What is malaria? According to the Centers for Disease Control, or the CDC, malaria is a serious and sometimes fatal disease caused by a parasite that commonly infects a certain type of mosquito which feeds on humans. Malaria still exists today. The World Health Organization stated that 87 countries and areas had ongoing malaria transmission, due to the fact that countries with malaria are largely poor nations. The disease maintains a cycle of disease and poverty. There's difficulty in providing accessible treatment to the poor. In addition, those affected in the U.S. have been through malaria transmission countries like Sub-Saharan Africa and South Asia. People get malaria by being bitten by an infected female Anopheles mosquito. Once a mosquito bites someone that has malaria, blood that consists of malaria parasites is taken in by the mosquito. Malaria parasites affect red blood cells, so it can also be transmitted through blood transfusion and sharing of needles. Malaria is prevalent in Sub-Saharan Africa and South Asia. The main risk for communities in the features the persistence of malaria around the world. The etiological factors of malaria include an individual present in an endemic region following a mosquito bite. Adding to that, to being present in an endemic region, one can also retrieve malaria through blood transfusions, organ transplants, and the sharing of needles. The CDC notes that the goal of the National Malaria Control Programs is to reduce the number of malaria-related cases and deaths. This is done by prevention interventions that have been created, such as insecticide-treated nets, ITNs, intermittent preventative treatment of malaria in pregnant women, IPTP, intermittent preventive treatment of malaria in infancy, ITPI, indoor residual sprayings, IRS, in order to prevent more people from getting affected by malaria. There are specific preventive treatments for pregnant women as their immunity decreases when they are pregnant. Children are also the most affected people with malaria. In addition, larval control and vector control interventions have been utilized. Currently, researchers are still trying to find a vaccine for malaria, as there are not any present. Previous examples of how malaria had been prevented include a historical example back in World War II, where volunteers from the Australian Army had been infected with malaria. Dr. Neil Hamilton Fairley had treated those infected with malaria with various drugs. From these experiments, he showed how important preventive drugs are in stopping the cycle of transmission. Another example is in 1933, where President Franklin D. Roosevelt had signed a bill that created the Tennessee Valley Authority to improve land for development. A malaria program stemmed from this authority. The Public Health Service had done several research and operations which resulted in the elimination of malaria by the Tennessee River Valley, which previously had 30% of its population affected with malaria. According to research papers, the most effective ways to prevent getting malaria is to use long-lasting insecticide nets in endemic regions, such as South Asia, when indoors and around your bed. Using an indoor residual insecticide spray reduces one's chances from getting malaria. In addition, larval source management by spraying insecticides in bodies of water to control mosquitoes is another effective way of preventing the spread of the disease. Developing housing that prevents the entrance of mosquitoes inside is another adequate method to prevent the spread of malaria. In my opinion, ways to prevent malaria is to decrease travel to endemic regions in order to end possible transmissions of the disease. Another way to prevent the disease is to give tests to those that leave endemic regions on whether or not they have malaria. Lastly, I suggest educating those in endemic regions about the disease through lessons in class or creating workshops for locals living in endemic regions on ways to prevent catching malaria. Here are my references.